with our live Q&A. And if you got any questions, make sure you type them into the live chat, and we'll get to as many as we possibly can today. We're going to start off with a story about Medicare.gov. How you doing today, Ari?
I'm doing great, Dr. Ed. How are you?
I bet you I'm doing way better than you, considering you and your team probably, 2-3 hours of sleep during this annual enrollment period?
We're certainly in the thick of it.
Yeah.
And the
So
Dodgers going 18 innings the other night didn't help either.
Is that crazy? Yeah. Oh, that was crazy. Yeah. That's like and they were in the clubhouse, and the coach says, hey, don't get too excited. We've got another game today, because it went into the next day.
Right.
So yeah,
Right.
I think they're tied 2-2 now. So it should be interesting. Hopefully Freddie Freeman can do it all again like he did last year. But all right, I digress. All right. So we're in the middle of the annual enrollment period, which began October 15th, ends in December 7th. Whatever, you still have time. We have a lot of people in the community that reached out to Chapter, and Chapter is way inundated right now. And Ari, I think, has a request to if you called and you weren't able to get in, please try again. And any other recommendations on getting the best help you possibly can?
Absolutely. Have your 6 Ps ready. And the 3, Dr. Ed, if you want to put it up. Dr. Ed came up with the 6 Ps. I only have 3. Dr. Ed made it
7
6.
Ps now. 7 Ps. I added prices on there. Yeah, so we've got have your 7 Ps ready. That makes everything so much easier. So for if you're shopping for a Medicare Advantage plan, if you're want a Medicare supplement plan, don't really need the 7 Ps. You need some of those, but not the 7. But if you're looking to review your Medicare Advantage plan, then have your current plan available, and that way they can compare apples and apples. If you have a particular provider that you need, or providers, or hospital, make sure you have that information, your prescriptions, not only the name, but whether it's extended release and the milligrams and everything like that. That way they can save you the most money on prescriptions. If you have a particular pharmacy you really like to use, or a mail-in pharmacy or whatever, exactly your priorities. If you want more vision, dental, and also prices. People say, well, they're all zero premium anyway, right? So it doesn't matter. Now, a lot of them are zero premium Medicare Advantage, but then you've got how much you spend for a hospital per night, $100 versus $500, MRIs, specialists, and everything.
Right.
And then for the other 364 days of the year, persistence. We got, I think it was a plant. Someone put a question in one of the comments that said, what are you talking about prior authorizations? Those are easy. They just, the doctor asks for a prior authorization and it's approved, that it's never denied. So I think a Medicare insurance agency got in there and made that comment, because a lot of people get denied on prior authorizations, correct?
Yeah, there were over 50 million prior authorization claims in 2023.
Yeah.
And if your prior authorization claim gets denied, it's a process in order to appeal. And that's something our team will help you with. You're not only supported by the Medicare advisor that you work with, you're also supported by our member advocate team, which is your first line of defense for any hiccups that come up with your coverage throughout the year.
Exactly. That's it. I mean, there's a lot of places out there that can help you find a plan, but it's the other 364 days of the year that you're actually going to be, well, it's actually 365 days of the year that you're actually going to be using that plan starting January 1st. And if you're getting a weird billing, you need to find a doctor, a specialist, you need help prior authorization, then Chapter is in your corner to help you out.
Right.
And I am in your corner to help you out with all things Social Security, retirement benefits, survivor benefits, spouse benefits, disability benefits. There was a big story, John Oliver, last week tonight on Medicare Advantage plan, and he did a really good job on it. He had mentioned that call your state ship to help you out. And from my personal experience, when I ran the Social Security Administration in my town, we used to send people down to SHIP all the time for that. And it's just mixed reviews. They're volunteers. They're not really funded. They're losing. I think they're pretty much losing fund. I think all government agencies are losing funding, aren't they?
Yeah, have been many cuts, not to Social Security or to Medicare. They haven't touched those entitlement programs, but yes, there have certainly been substantial cuts to volunteer agencies like your local SHIP.
And I know personal examples of SHIP advisors who help out other people in the community find a plan for them. And then when it comes to their plan or their family's plan, they call someone that does it professionally. So that's kind of an indication that, they give out information to other people. They're volunteer. I'm never going to talk bad about volunteers. So, but if you want to make sure that, you really need to talk to a professional.
Yes. And these state health volunteer organizations are certainly well-intentioned. It comes down to a question of tooling, though. And the Washington Post had an exclusive piece on Medicare.gov's provider search. For the first time, Medicare.gov has launched provider search for Medicare Advantage plans. Here's the issue, though. Over the last 2 weeks, what people who have tried using Medicare.gov's provider search have noticed that there's duplicate locations. So which address do they pick for their doctor, right? If your doctor practices at 8, sometimes a dozen locations, and you see duplicate addresses, what happens when that very same address shows in network, but out of network at it? Which one is source of truth? And that is something that that is a problem that our team has a solution to. We have built our own platform that shows whether your doctor is in or out of network. Of course, we're using the provider search information that the insurance companies give to us and that they give to Medicare. But we're also adding our own secret sauce in order to avoid that duplication issue. And you need to make sure, if you choose Medicare Advantage, that your doctor is in network at the location where you see them. This is critical. Even if your doctor shows as in network, if they're out of network at the location where you see them, then they're out of network. And you're going to pay more if you're even allowed to see them at all.
Yeah, I think that's one of the things that John Oliver talked about in that story, is that the physician was covered, but the physician saw the person in wasn't covered.
Yes.
And then there's a situation I've heard where people go in for surgery and the surgeon is covered, but the anesthesiologist that they bring in isn't covered. So it's something needs to be done about the entire thing. I know the chapter management team, the ownership team goes to Washington, D.C. quite often and tries to fix this. So definitely keep working on that front as well. If y'all ever need any, crowdsourcing for reaching out to politicians and saying, hey, this needs to be changed, this needs to be changed. We have the best community on the internet, on social media. So definitely reach out to us. Let's see. Max spoke to Ann at Chapter. She helped me get back to original Medicare. Perfect service. Okay, good deal. We like to hear it. So what are we talking about?
This time is for right now. So during the annual enrollment period, you can do 3 things. First, you can go from Medicare Advantage back to original Medicare. And if you go back to original Medicare, then you would want to make sure that you have coverage for the other 20% you're going to owe out of pocket with no limit on your 20%. So there, you would want to consider a Medicare supplement plan and a standalone prescription drug plan. The second thing you can do is shop your Medicare Advantage plan. Make sure you do this every year. And the other thing, the third and final thing you can do, is optimize your standalone prescription drug plan or sign up for one for the first time.
Perfect. Yeah. So now is until December 7th, and the new plan won't start until January 1st. So we still have time. Let's see here.
Thank you.
Yep. Hey, Bella, how you doing today? She just got out of the hospital. She was in a hospital for a few days, and now she's back. She's back to her old awesome self. Welcome back, Bella. So someone, let's see, a few people said they called chapter and it was, they weren't able to get through. Any recommendations on that, best times to call? Because I know you told us last time y'all are open from 8 to 10 East Coast time, Monday through Friday, and
Mhm.
Saturday and Sunday from 9 to 9.
That's right.
Yep.
Those are our hours. And we're worth the wait. So if you call in, yes, there will likely be a wait, especially in the early afternoon. We're going to do our best to get back to you before the end of the day. If we don't get back to you before the end of the day, we'll probably get back to you by the next business day. Persistence and patience are key. You have until December 7th. So even if you're not able to optimize your coverage today, we can help you at any point until December 7th at the stroke of midnight. That's when, and oftentimes we're up until Hawaii until Hawaii hits midnight on December.
Right.
December 7th is the longest day of the year for us.
Okay. Yeah. Don't definitely don't call don't wait till December 7th. I think Ari recommends calling on the Marine Corps birthday, which is appropriate. Old Marine Corps sergeant here, November 10th. Things might slow down a little bit. So
Yes,
the Marine Corps birthday, November 10th, or Veterans Day. You're still going to be working on Veterans Day, November 11th, right?
yes, we are. So the first 2 weeks are often crazy, and then the last week, the week following Thanksgiving, right? Because that's when the procrastinators come out of the woodwork. And I don't mean that in a derogatory way as a fellow procrastinator myself.
Yep.
That's you. If you call sometime in November, that's a great time for us to talk about your coverage. Dr. Ed suggested November 10th. Put it on your calendars. That can be Medicare Review Week, the week of November 10th.
Right. We might have to do a special episode on that, maybe Veterans Day or Marine Corps Veterans Day episode. Yeah, and we'll reach out to as many veterans and give them help on all things Social Security and Medicare and all the rest of it. A lot of veterans always wonder about, I've got the VA, should I even sign up for Part A, Part B? What do you say to that for those veterans out there? And 99.9% of the time, they just don't want to pay the extra $185 a month or whatever it's going to be for next year. If they're relatively happy with their VA, what do you recommend for them?
So for veterans, if you go to the VA for 100% of your care, if there's a VA facility near you and you're comfortable receiving all your care then at that location or at a VA facility nearby, then yes, you technically do not have to sign up for Part B, and you would save the $185 per month charge for Medicare Part B. But the downside would be if you change your mind later on and you decide to go to a private doctor who isn't part of the VA, then you would probably want Medicare Part B at that point, and you may owe a late enrollment penalty for Medicare Part B. There's also a special subset of plans for veterans called Medicare Advantage only plans. Oftentimes these plans have more generous additional benefits. Still, we would need to make sure that the doctors that you want to see are in network with that plan and that it covers the additional benefits that you're interested in, oftentimes dentistry, for example.
Yeah, one of the things I always add on that, if you're happy with the VA right now, but the situation changes. If you move and you're no longer near a VA facility, and the VA has announced they were trying to cut back 85,000 jobs, but a lot of people, including people in our community, reached out and said, yeah, no, don't even try it. So now they're working it through attrition. So now they're looking to reduce VA staffing by about 35,000. And that's going to hurt a lot of VA facilities throughout the country. So you might be happy with the VA now, but is that always going to be the case? So it's always good to have a backup. And as I always say, all the veterans out there, do you have to have Medicare Part B? No, you don't have to do, as our drill instructors used to tell us, no, you don't have to do anything in life. But if you don't, the repercussions are the penalty. So if you decide not to sign up for, if you decide not to sign up for Part B when you're first entitled at 65 or being on disability for 24 months, then you're not penalized. You're penalized when you change your mind later, or life changes your mind for you when your situation changes, and then you have to sign up for Part B. Then you're penalized 10% for every 12 months you did not have Part B when you were supposed to. So, and that's forever.
And I was helping a vet last week who they were 71 years old and they didn't start Part B when they turned 65. And because they've gone a full 5 years without Medicare Part B, they're going to owe a 50% late enrollment penalty. And now they do want to see private doctors. They want to go outside the VA, but they're going to owe a lifetime late enrollment penalty for Medicare Part B. So it's highly consequential, the decision whether as a vet to take Part B or not. And many, many vets choose to pay the Part B premium.
Or there's another option out there, the Part B give back plans. If there's one available in your area, it pays. What type of trends do you see for 2026? Do you see anything that you notice of those are continuing, or what it basically is the health insurance company, the Medicare Advantage plan you sign up for, pays for part of your Part B, $50, $100, $150, maybe all of it, depending on what's available in your area. Do you see any trends for you personally in terms of they're paying more next year, or there's less of those plans? What are you seeing?
There's a lot of geographic variation. So first, the availability of those plans depends on where you live. If you live in a place that offers them, it could be a good option. What's most critical, though, is that the doctor you want to see is in network with that plan, because it is a code red emergency if your doctor doesn't accept that plan. Then you're either not going to be able to see your doctor, or you're going to owe 100% at the time of service, unless it's a PPO and the provider accepts your plan's terms and conditions. So it really depends on where you live. What I'm seeing generally is that the plans have gone a little less generous for last year. Or for the upcoming year, compared to the last 5 or 6 years. Medicare Advantage insurance companies are oftentimes in one of two modes, growth mode or margin mode. When they're in margin mode, oftentimes they're offering less generous plans. And what we see, and the Wall Street Journal and New York Times have had articles on this recently, is that Medicare Advantage insurance companies have gone into margin mode, which means they're offering less generous plans. So all the more reason to review your coverage during the annual enrollment period. Make sure you're getting all that you deserve.
Exactly. So one of the biggest keys is to make sure the doctors you like going to, the clinics, the hospital you like going to, is covered under that plan. And that's kind of what today's topic was about, is people are potentially going to lose money, and the doctor that they know and trust, because Medicare.gov portal is not working the way it's supposed to. So you get a lot of people out there, including, unfortunately, those SHIP volunteers that might not know, keep up on the new details, the new information, and they might find you a plan as, oh yeah, according to Medicare.gov, or according to this, this doctor is covered, everything is beautiful, let's go ahead and sign up for that one. And then January 1st or January 15th, when you go into that doctor, and you find out they're not covered in your particular plan. And then possibly, what's even worse, if you find out after the fact, and then you get a bill and you have to pay the bill because your doctor isn't covered.
Yes. 4 states come to mind where I've seen a lot of errors: North Carolina, Wisconsin, Minnesota, and South Dakota. I've just seen a lot of mistakes on the Medicare.gov provider search in those 4 specific states.
Yeah, during our live Q&A a few days ago, someone said, yeah, the used chapter was awesome, and the person, I forgot the person at Chapter's name, I should have remembered, I apologize, whoever that was, but they said, oh yeah, this person at Chapter actually called my doctor to confirm the doctor was covered. So I thought that was pretty awesome, just triple checking there, right?
Yes, we will call the insurance coordinator at your physician's office to confirm that they will accept the plan for the upcoming year.
Perfect. Triple checking. I like it. Kathy, I have a particular You can read that. I try to avoid reading company names. Is it no longer accepted? What do you say? People say, ask all the time, is this a good plan, or is that a good plan, or what's going on with this particular plan? And it's all depends on the particular area, right?
It depends on the plan's provider. It depends on the plan's provider information. It depends on the doctors that you want to see and the location where you want to see that doctor. And then we go plan by plan to make sure that the provider accepts the plan where you want to see them. On the original Medicare side, almost every provider nationwide accepts original Medicare. So if you don't want to deal with plan disruptions, network disruptions, your doctor being dropped mid-year by your insurance company, then original Medicare might be for you. And then you would want to consider a Medicare supplement, also known as Medigap, and a standalone prescription drug plan. If that's not affordable for you, then Medicare Advantage is still a great option, though, because it will at least have a maximum out-of-pocket protector. But you only have two options, Medigap and a standalone prescription drug plan, or Medicare Advantage.
So everybody's different. Dog, cat, truck, car, Medicare Advantage, Medigap, right? It all depends on your particular situation. So just confirming, Gloria asks, one get Part B and C when they retire, not before, correct? Not necessarily. People can still work. So you get Part B and C, A, B, and C, and D. When you turn 65, or if you're on disability after 24 months. But if you're 65 and you continue to work, Social Security has limitations. If you're 65 and your full retirement age is 67, you can continue to work. It's just that you have to stay under the annual earnings limit. This year it's $23,400. Anything over that, Social Security holds back $1 for every $2 you go over. But in terms of Medicare, yeah, you can continue to work and receive Medicare A, B, C, D. If you have health insurance from work, then you don't have to sign up if you have current insurance from work and your employer has 20 or more employees, right?
Rule of 20, that's the simple rule. Yep. If you or your spouse work for an employer with 20 or more employees, then you do not need to start Medicare at 65. Everyone else needs to start Medicare at 65 because that's what's designed to be your primary insurance.
Right. And some people, they start Medicare Part A, but they don't start Part B because they want to save $185 and they have health insurance from work they're happy with, 20 more employees and all that. And why would somebody want to start Part A while they have health insurance from work? What's the benefit there?
Because then, even though your work provided coverage will be primary, you might receive protection if you were hospitalized because you started Part A. You actually receive a red, white, and blue card that says Part A only. Now, there is an exception here. If you're on a high deductible health insurance plan and you're contributing to an HSA, a health savings account, then you do not want to start any part of Medicare. So you can continue to make contributions to your health savings accounts. Health savings accounts are amazing. They're an awesome retirement savings vehicle. Do not start any part of Medicare if you intend to continue contributing to an HSA.
There's a lot of debate out there. It looks like the one big beautiful change that for 2026, there's a provision in there that in the final one that was signed into law, we're still checking on that. I've seen different things in there. So, but we'll get back with you on that one.
My understanding is that that change, though it was proposed, actually did not make it into the final bill. Yeah. We can come back and update the audience, but this is a point of dispute.
Right.
For now, if you're contributing to a health savings account, do not start any part of Medicare.
Right. Is it true once you get on an Advantage plan, you can't go back?
No, that's not true. You can date your Medicare Advantage plan every year. So every year you want to review your Medicare Advantage plan. There's no questions about your health history in the Medicare Advantage universe. Now, if you want to switch from Medicare Advantage to Medicare Supplement, then in 46 states, there might be questions about your recent health history if you're outside your Medigap open enrollment period, which is the 6 months after you start Medicare Part B. The only 4 states that are an exception are all along the Northern Atlantic seaboard: New York, Connecticut, Massachusetts, and Maine. If you live in one of those 4 states, then a carrier is not allowed to ask questions about your health history.
What are these? Some states like California, they also have birthday rules. That
Yes.
the birthday rule is you can't switch from a Medicare Advantage to a Medicare Supplement on your birthday. You can do other things at your birthday in those particular states, right? And I think there's some states that are adding those type of birthday or anniversary rules, right?
Yes, I know your site is doing a great job cataloging which states have birthday or anniversary rules. This is for people who are already on Medicare Supplement. So if you're already on Medicare Supplement, you can use your state's birthday or anniversary rule, and each state does it a little differently of those that have established this rule, but it allows you some flexibility in order to change your coverage. Let's say your Medigap insurer has raised premiums. Well, you can use your state's birthday or anniversary rule to potentially switch to a lower cost carrier.
Those states that have birthday rules, people have like a Medigap plan, a particular state. Every year during their birthday, they can just keep switching to the cheapest plan, theoretically, right?
Yes. In some states, that's exactly how it works. There's a few states that come to mind. And actually, this is something that is right in our platform. Our advisors see it. If you live in a state that has that rule and you're also within your birthday or anniversary rule, then we can advise you to switch to a lower cost carrier, because Medigap is standardized under federal law. Each letter type is standardized. So the insurance companies cannot vary on the hospital or medical benefits that they're offering for Medigap. They can't pick and choose which services to cover. If original Medicare covers 80%, then the other 20% is forwarded automatically to the Medigap insurer of your choosing. And the only question is whether you've met your Part B annual deductible, which for this year is $257. So if you're on Medigap Plan G, which is the most comprehensive and flexible Medigap plan letter type for someone who recently turned 65, and you've met your Part B annual deductible, which is $257 for this calendar year, then your maximum out of pocket is also $257. And I don't know about you, Dr. Ed, but my deductible here at Chapter is $6,000. My wife, daughter, and I don't see a dollar of benefit until we've paid $6,000 out of pocket. And then our maximum out of pocket is $11,000. So I can't wait to be on Medicare.
Great. Yeah, the whole industry is crazy. So it seems like everybody in those birthday states, they would all kind of erase to the bottom every time they hit their birthday. Everybody would just switch to the lowest plan available in that time. It seems like the entire state would be in the lowest possible plan. Yeah, it seems not sure.
That's how it does work in some states, if people stay on top of it and know when they're in their birthday or anniversary rule. And that's something that we can help you with. That's something, even if you're not within your birthday or anniversary rule, we can follow up with you when your birthday or anniversary rule does roll around. So that way, even if you're not healthy enough to answer a Medigap insurer's questions about your recent health history, you can still take advantage of your state's rules in order to switch to a supplement, a given Medigap plan letter type that offers identical benefits at a lower price.
Okay. All right. So yeah, definitely that's where the persistence comes in that particular case. Persistence on, speaking of that, we'll talk to Ramsey here, but persistence in terms of Medicare Advantage, making sure, you're billed correctly, making sure you get your prior authorizations, make sure you're in the best plan every year. There's a lot of extra work you have to do if you're in a Medicare Advantage plan. And a lot of people, don't know all of the other ins and outs. That's why it's always good to have an expert on your corner like Ari and his team. And then, we're here to answer questions. But a Medicare supplement, the only persistence you need is to make sure you're paying the least you possibly can. And
marry your Medigap, date your drug plan.
There we go. All right. So yeah, so I'm sure there's a bunch of people in those particular states. I'm sure they don't like to advertise that you can switch plans in those birthday states, because they don't want to, to lose you. But I think in a few states are adding those, I heard, for 2026, or thinking about adding birthday rules or anniversary rules or something.
Yeah, that's right. There have been states that have continued to create birthday and anniversary rules. I believe the list is up to 13 states. And I know that each time we have a special announcement that a state has created a birthday or anniversary rule. And it's something we celebrate, because that means that you have more choice in order to pay a lower amount for identical coverage.
Perfect. So you have a birthday party, but it's not necessarily your birthday party. All right, so let's see, Ramsey. Speaking of persistence, sometimes an appeal can be life-threatening. Depends on the time it takes, what to do to speed up the process. So we're talking appeal. I assume we're talking about prior authorization, where, again, this is not Medicare supplement. You don't need prior authorization. Well, actually, they're starting to add kind of prior authorization in as a limited number of states, 6 states for 2026 or so. But this is predominantly for Medicare Advantage plan, that if the doctor says you need whatever procedure, that's fine. That's the starting point. Then they have to contact the Medicare Advantage plan to get that prior authorization. And then if they say no for whatever reason, then you're kind of in a bind unless you can get help fighting that. And that's where Chapter, if you're a client of Chapter can reach out and help you, correct?
Correct. That's exactly right. We will fight on your behalf. Oftentimes, insurance companies need to respond to your prior authorization request in a very narrow time frame, because, as you mentioned, Ramsey, these can be life-threatening situations. So oftentimes they need to respond within 24 to 48 hours once your doctor submits the prior authorization request. And then if it's denied, there's an appeals process.
So it's always good to, I can speak to Social Security anytime you file a reconsideration appeal, the SSA 561 or the SSA 501 for the administrative law judge. It's always important that you explain your situation correctly, to make everything easier. Particularly when the people have only, 24, 40 hours to get back to you. And so I'm sure they, how many prior authorizations or so did you say? 50? I don't want to
50 million, according to the
million.
Kaiser Family Foundation, in 2023 alone.
Wow. And most people don't fight those prior authorizations, right? The people that actually fight them, those are the ones that actually better chance of getting approved, right?
Of course, each insurance company spells out how to appeal a prior authorization request. And this is something that we've documented here at Chapter, and we know each insurance company's playbook inside and out in order to fight on your behalf and be your champion.
All right. So y'all are the Otanis of prior authorization. I like it. Alley Cat, this year the MA plans in my county are limited to 4 insurances. Is there something that causes this? My provider from last year's dropped out. Oh my gosh. What are you, probably out in the country, out in the desert somewhere?
Yes, in rural areas or less populated counties, we've been noticing this more and more. Unfortunately, insurance companies are either exiting the market, which can create an opportunity for you. If your plan is being terminated, then you actually are entitled to choose a Medigap plan by way of guaranteed issue. And your insurance company, if they're terminating your plan, would have sent you a letter that says, hang on to this notice. This is your notice that affords you a guaranteed issue right for Medicare supplement. And then you can use that to sign up for a Medigap plan without any questions about your health history. Or we can look at however many options there are on the Medicare Advantage side and see if there's a plan that all of your providers would accept.
Yeah, there's I know out in the desert there, there's some of those only have like one Medicare Advantage plan, and that company is, anyway, I'm not going to say, yeah, they're very, very limited, let's say.
Yes, in more rural areas, it can be very limited. And that's because insurance companies have decided to exit those more rural areas because they were losing money on the plan.
Yeah. So yeah, I mean, the only alternative for that is, got to contact your political representatives and see what, because this is, CMS, the Center for Medicare and Medicaid Services, they're the ones that oversee all of this. So hello, Ari and Ed, my neighbor who is 70 years old. So Octed, okay, Octed, you are our first superhero of the day, looking out for your neighbor, looking out for those around you. So thank you very much. So my neighbor, 70 years old, widow on dual Medicare, also has extra help. So that would probably be the extra help with the Medicare prescription drugs, also called the low-income subsidy that helps with prescription drugs. Yes. CMS sent her a red letter. Ooh, the red letters are never a good thing, saying she will need to pay a fee for generic drugs and more for brand name. Any help for her? What do you recommend, Ari?
Well, I would recommend that we absolutely review your neighbor's coverage to see what level of Medicaid she has. There's more fact finding that we would have to do here. For example, does the state reimburse your neighbor for her Medicare Part B premium? Beyond that, when your neighbor goes to the doctor, are they billed any copays or coinsurance? If they have full Medicaid, if they're a fully qualified Medicaid recipient, then a provider isn't allowed to charge them for their service.
Yeah, a lot of people don't recognize that, before I worked for Social Security, I worked for a Department of Welfare doing Medicaid and food stamps. And a lot of people don't realize that Medicaid has several levels. So, Medicare has several parts: Medicare Part A, Part B, Part C, which I hate being called Part C, but anyway, it has Part C, Part D. But Medicaid has different levels depending, because it's a welfare-based program, your income and resources. So the highest levels is QMB, and then you've got the SlimBs and the QIs. And if you have those type of higher level plans, they will pay for your Part B premium, the $185 or whatever it's going to be next year. If you have the lower one, then you might have some cost sharing, some more cost sharing. You might have a deductible that you have to pay a certain amount before it kicks in. So it all really depends. So it sounds like she has Medicaid, he or she has Medicaid, but perhaps the lower levels. So yeah, let's make sure.
And what that red letter means is that they no longer automatically qualify for Part D extra help, which means previously they had been re-upped for Part D extra help, which covers your neighbor's prescriptions, provides it can save your neighbor up to $5,100 per year on their medications. Now, it's not, as Dr. Ed has mentioned, now that there's a maximum amount of pocket cap on Part D, it'll be $2,100 for next year. There still is some protection for your neighbor, but it means that your neighbor no longer will automatically qualify for Part D extra help. It doesn't mean that they don't qualify. It just means that they may need to reapply for it.
And the extra help with prescription drugs, you apply through Social Security. And I can tell you from firsthand experience, I've done this a million times, that is the easiest application in Social Security. So if you file for anything else, retirement benefits, survivor benefits, original Medicare, whatever, it's a lot more complicated. But the extra help with prescription drugs is super, super easy. You can do that over the phone, call the 800 number, call your local office and apply. It's a one-page little simple form.
So, very quick to fill online, and that's something you can easily help your neighbor with.
Exactly. Very. Sheila, 2 years ago, I went from original Medicare to a company. I have Medicaid also, the SlimB. Should I switch back to original red, white, and blue card?
Sheila, it's going to depend on the doctors that you want to see for the upcoming year and how it's covered under the plan that you've been on. So I would say let's do a full review.
But she has Medicaid, so but she can't get a supplement because she has Medicaid, right?
Correct.
Yeah, so she can't get the Medicare supplement, also called the Medigap. You can't get one of those because if you have Medicaid, you can't sign up for a Medicare supplement plan because it's just, you have Medicare. Let's say you have, if you want to sign up for a Medicare supplement, you have to have Medicare Part A and Part B. So you have Medicare Part A, Part B, and you also have Medicaid. So most of your costs are already covered. So the logic is, which is good logic, the government doing good logic, it's unusual, but when they do it, I guess let's talk about it, is they say, why should you pay for a Medicare supplement plan, whether it's $80, $100, $120, whatever the case may be, you're paying for that every month. And the Medicare supplement plan doesn't have to do anything because everything's covered by Medicare and Medicaid. So they say, yeah, we shouldn't have people pay for a Medicare supplement plan that is not going to do anything. So that's why you can't sign up for one. But you can say, okay, I just want to have Medicare and Medicaid. I don't want to have anything else. So that is an option, correct?
That is an option, absolutely. And it might be the right option, depending if there's a plan that coordinates benefits between Medicare and Medicaid. If there's no plan that coordinates benefits between Medicare and Medicaid and covers all of your doctors, then yes, it would be better to just be on original Medicare and have Medicaid for cost share protection.
Perfect.
Yeah, we covered that one. So let's see this one from Frank.
All right. Thanks, Justin D. from Chapter, who helped me navigate through a myriad of sup plans to save me lots of money on premiums. I like it. My wife and I have Medicare C plans. A and B will both be adding G. I like it. So good
Don't
deal.
forget the standalone prescription drug plan. Then you have comprehensive insurance.
So many people, in particular. Okay, what's going on with?
Oh my gosh, Dr. Ed, I was helping someone yesterday. Their spouse had signed up for a Medicare. Their spouse turned 65 4 months before they did. So their spouse turned 65 in July, and their spouse didn't sign up for a standalone prescription drug plan. So we were helping this gentleman whose birthday is next month. Their coverage is all going to start November 1st, but their spouse missed their chance to sign up for a standalone prescription drug plan. Now they're going to have a lifetime late enrollment penalty. It's going to be a small penalty because we're helping them sign up for coverage for January 1st on the prescription drug side. But if you sign up for Medigap, remember, you don't have Part D. Part D is separate. And so if you go Medigap, you want to sign up for a standalone prescription drug plan as well in 98% of instances. Even if you don't take any prescriptions at all, there's standalone prescription drug plans that aren't very expensive in your zip code, in most zip codes. And so want to make sure, even if you don't take any prescriptions, when you sign up for a standalone prescription drug plan, you will have a late enrollment penalty unless you have drug coverage at least as good as what Medicare offers. So for example, a veteran, they have drug coverage at least as good as what Medicare Part D offers. They get their drugs through the VA. But if that doesn't pertain to you, then consider signing up for a standalone prescription drug plan when you go Medigap. Marry your Medigap, date your drug plan.
All right. And then if you miss that, so let's say you didn't sign up for a prescription drug plan, when can you do it? Like if you miss your Part B, you can't sign up until the general enrollment period, which is January, February, March. But if you miss signing up for Part D, when can you sign up for the Part D?
Right now, and your deadline is December 7th. So the time to select your standalone prescription drug plan is October 15th to December 7th. It's the annual enrollment period, which is the time we're in right now.
And then you're going to be still going to be penalized 1% for every month you did not have Part D when you were supposed to get it, correct?
1% of the national monthly average, which was approximately $40 to $45 for this year. So that's about 40 to 45 cents per month for every month you went without Part D coverage after you were first eligible.
And I know you know, but it's going to get a lot worse because a lot of the prescription drug standalone plans, they are not giving agents, brokers throughout the country commissions to help people, just like life insurance or car insurance. When you sign up with you find someone to help you, search all the plans, you don't pay them. The insurance company pays them once you pick whatever one you like. Same thing with Medicare Advantage, Medicare Supplement, Part D. But with Part D, some of these companies out there have decided, no, we're not going to pay you to help people. So unfortunately, there's going to be a lot of people that sign up for a Medicare supplement. This is only if you're a Medicare supplement, you will need a standalone prescription drug. And because there's a lot of agents out there that it's like, well, I don't make money on it, so I'm not going to help you. So yeah, you don't need one. You don't want one. You don't need one. And then whatever. And 3 years, 4 years, 5 years later, when the person does need one, they're not going to be able to sign up for that one until the end of enrollment period, and they're going to have to pay a penalty. I think it's going to get a lot worse in the future. You
I would expect yes, the national monthly average is undoubtedly higher for 2026 than it was for this year, which means the 1% of the national monthly average is also going to be higher. And I've noticed that for some standalone prescription drug plans, the premium has spiked. In our last live, there was someone who was experiencing a 4x premium increase on their drug plan for next year. So this is the time for us to help you review your drug coverage for next year as well.
Mari asks, why not stay on regular Medicare and forget this private insurance crap? I think that's the technical term. Yeah, but you still, if you have original Medicare Part A, Part B, awesome, perfect. But there's a lot of gaps in there. The big one is Part B. If you get $100,000 surgery, you have to pay 20%. So $20,000 out of pocket. So if Mary, if you have a whole bunch of money under your mattress, hello, hey, how are you? And number two, a lot of people don't. So they will need a private insurance. And then again, the two choices are Medicare Advantage or Medicare Supplement. And so if you do have some money under your mattress, if it is in your budget, I always recommend checking out a Medicare Supplement first, a Plan G or a Plan N. But a lot of people just don't have that in their budgets, and they're young and healthy at 65, so they choose the zero premium option, or they don't know there's another option out there. And some love it. Got a lot of people that are part of our community that love it. Can't say anything bad about the company they're in. So awesome, perfect, love it. Just make sure you stay persistent on those. But other people, there are other options out there.
Yeah, and some people might get the impression that Dr. Ed and I are pro Medicare Supplement. We're pro having some type of additional protection for the 20% you owe out of pocket. And there's no limit on that 20% you owe out of pocket, Mary. So just take that into account. If you want to stick with original Medicare, just be aware, as Dr. Ed mentioned, you will owe 20% out of pocket on your medical service. And not to mention, what are you going to do if you're hospitalized? Because there's also a deductible on Medicare Part A, and it can add up really quick if you're hospitalized. It can be thousands of dollars.
Patty Young asks, I just want to thank you, Dr. Ed and Chapter. I got my phone appointment and got my insurance straightened out, and they found me a better plan in my areas. You guys are awesome. All right, good deal. Thanks, we also
Patty.
have someone that wants a kind of a second opinion.
Okay.
And this is important as well. So if it doesn't matter who you talk to, they always say when you talk to a doctor and they say something critical, then it's always good to get a second opinion. So in some respects, this is kind of perhaps the same thing. So even if you contacted someone else, whoever contacted, who, and you're like, I'm not really sure. And they've already signed you up in the plan. So if you talk to someone yesterday, whoever it is, your nephew, someone in your town or something like that, and you're not 100% confident, but you're like, well, I've already done it. I've already signed up for that plan. Are they done? Do they have any options? You can
still get a second opinion. And the last plan that you submit by the December 7th deadline will be the coverage that goes into effect on January 1st.
So long story short, you signed up another plan yesterday, doesn't matter. If you call Chapter or whoever you want to give you a second opinion and they say, no, that's a terrible plan because it actually doesn't cause your doctor, or it covers your doctor, but you're going to pay, this much more for your prescriptions and all the rest of it. There's actually another plan out there that's better. Then what happens is they sign you up for that new plan, and how it works is whatever Medicare.gov CMS, whatever is on the books, December 7th at midnight is the one, right?
That's the one. Knockout.
All right.
Knockout rules.
All
Last
right.
one in by the December 7th deadline is the coverage that will go into effect on January 1st.
Perfect. And again, as I always say, this is just signing up for a plan is, the 20 or 30 minutes out of the year. That's extremely important. But the other 365 days of the year from January 1st, it's good to have someone in your corner. I'm going to be here making videos on a daily basis, knock on wood. Life is what happens while you're making other plans. But my plan is to continue 365 days. My wife might make me take a few days off next year. Yeah, I'm going to be here pretty much every day answering your questions on all things Social Security, retirement, disability, survivor benefits, spouse benefits, Medicare Part A, Part B. But in terms of your particular plans, because there's thousands out there, and it's we don't want to be talking about your doctors live on QA and what you're, so yeah, that's why I reached out to Ari and his team over there at Chapter. They can help you with that, and we'll have Ari back several more times, hopefully next year as well, right?
I would love to.
All right,
I enjoy these Q&As so much.
All right, good deal. We really enjoy having you. Peace and love, Dr. Ed. In Chapter, I have an advantage. Also, what happens with it? I'm in Atlanta.
Anastasia, we review your 7 Ps. Perhaps the plan that you've been on is the right one for next year. I don't know what your 7 Ps are, so I can't say one way or the other. You might have already found yourself the plan that's worked best for the plan that you've had might be the right one for you for next year. We can't say until we do a full x-ray of the doctors you want to see, the prescriptions that you take, your priorities, for example, what additional benefits you have, how much you have used the coverage over the last year. That matters a lot too in terms of your copays and coinsurance, yada, yada, yada. This is all something that we'd be delighted to help you with in a one-on-one consultation.
Perfect. Yeah, a lot of people don't realize that they might love their Medicare Advantage company, but that particular company, there's almost a guarantee, 99.9% of the chance that that particular company has another plan in your area, another 2 or 3 or 4 or 5 plans, and they might be coming out with a new plan for 2026. And you've got the 1972 Pinto version, and you might want to get the new Corvette version for 2026. So it really depends on your particular situation.
Especially in an area as dense as the Atlanta metro area. There's a lot of competition in the Atlanta metro area. Same is true in the Chicago metro area. If you live in Cook County, for example, or if you live in New York, if you live in LA, or the list goes on. But there's a lot of competition in these dense metro areas. So you might see 50 to 60 different Medicare Advantage in plans. There might be 10 to 12 insurance companies offering 50 to 60 plans. It depends where you live.
And the plan that your next door neighbor or your relative, unless they're, I guess, their biological twin, and you have exactly, the same doctors and everything, then you might say, oh, okay, well, that's the one my biological twin has, and we have the same issues and same doctors. So, okay, then you maybe get the same plan. But if you're not biological twin, I wouldn't take anybody else's recommendation because your doctors, your particular situation is different, right?
I can speak from firsthand experience on this, having twin younger brothers. They have very different issues.
Okay. All right. So 99.9% of the chance. So there's always, always check your particular situation. And that's one of the reasons I do a video every now and then about Social Security. When you should take retirement, you got all these retirement, experts out there that said, oh, you should do it at 62, 65, 67, 70, when you should start your Social Security. And yeah, nobody can tell you unless they, do stuff like, ask you a whole bunch of questions with Social Security retirement. Same thing on a Medicare Advantage. Nobody can tell you which one is the best for you until they go through those 7 Ps. Someone was asking about Tricare. What do we say about Tricare? If someone has Tricare, do they need a Medicare supplement plan? Do they need a Medicare Advantage plan?
First thing we say to those on Tricare is thank you for your service. The next thing we say is take Medicare Part B and you're done. You receive a $0 Medicare supplement plan from the government as a thank you for your service. You also receive excellent drug coverage. So just sign up for Part B, do it through your online Social Security account. Fast, safe, and secure. Certainly beats waiting on hold for the Social Security Administration call center, and then you're set. Don't sign up for anything else and ignore all those unsolicited phone calls, spam text messages, and direct mailers.
I know the Managing Over chapter is trying to do something about that. They went up to Congress, and yeah, in any movement there.
Well, it just seems to get worse and worse, right? I mean,
Yeah,
we all have silenced unknown phone, an unknown caller. We've done videos about this, Dr. Ed.
yeah, yeah. It's
Only people who are allowed to call you are those you've given your permission to be contacted by. You have to give your permission to be contacted. Even if you send Dr. Ed an email with your phone number, that's not permission to contact you.
all right. Yep. So here's how it goes. Someone emails me, let's say Pat Murphy here, who had an excellent experience with a chapter. So thank you for letting us know. Pat Murphy says, Ed, tell Ari to call me. And I turn to Ari and I says, hey, Ari, call Pat. What do you tell me?
I mean, I feel like this happens once a week. And I have to say, I'm sorry, Dr. Ed. Pat needs to call us. I don't see that Pat has tried to call us yet.
Yeah.
But
yeah,
I'm not sure. I'm not sure because I do see you have a question from Pat up right now. Pat, Pat Murphy, I don't know if you've tried to call us.
Yeah. Well, actually, Pat's all set up. But if you send him an email and say, Ed, I tried a few times and I couldn't get through, and you include your phone number, then I can forward that on to Ari and said, hey, this person is having an issue getting through. And then they look it up in your system. And if that person has called before, then it's just a follow-up. It's just a return call.
Within the last 90 days, yes.
Yeah. But if it's a brand new number, then I just have to say, hey, no, please try again. And that way you're established in their system that you did call first, and we're just kind of following up. See how technically crazy that is, but that's the way it should be. That's the way it is, period.
The rules are the rules.
The rules are the rules. But unfortunately, all those people that are calling you 10 times, 20 times a day, 30 times a day, they're not doing it the right way. And if they're not doing that the right way and harassing you because of it, then I don't think those are people that I would want to do business with and trust my wallet and my healthcare. Yeah, personally. So
you're a Marine. How you do anything is how you do everything.
There you go. I like it. I like it. My husband and I had great experience with Chapter. We spoke with Becky. We changed from a plan F to a G, went from one to another, saved mucho bucks. That is unusual, Pat, to switch from an F to a G.
No, it's not.
F, it's because
it's a great idea.
Yeah, it is, but
Here's why.
A lot of people can't, right?
Well, it depends.
Because, yeah.
It depends. It's a great idea, though. Plan F previously was the most comprehensive coverage. It was replaced by Plan G. So for those who turned 65 before January 2020, the most comprehensive Medigap plan letter type that you could get was Plan F. The only difference between Plan F and Plan G is the Part B annual deductible. Plan F covers the annual deductible. Plan G does not. But here's the thing. We can dollarize it. The Part B annual deductible for this year is $257. So if you would save more on your Plan G premiums than the cost of the Part B annual deductible, then it is a very good value to you to switch. And great job, Ted.
Absolutely. Absolutely. But what my argument is what I've seen is the people that have Plan F, have had it for a while. And a lot of those people I've seen, their health issues have, developed, and they can't pass the health underwriting. So a lot of, I think that's the issue. So Pat must be very, very healthy. And because what is health underwriting? I mean, does Chapter go out to people's homes and do a physical?
No, it's not like a life insurance exam. No one comes and takes your vitals and draws your labs. It's not like that. It's a few questions about your recent health history. They vary based on the Medigap insurer that you're applying for coverage with. And in 46 states, if you're outside your Medicare Open Enrollment period, then you're probably subject to those questions about your recent health history, unless you have a guaranteed issue right. For example, your plan is being terminated, or you're moving and you're losing your coverage, or if you have a state anniversary or birthday rule that applies.
Yeah. Okay. So I guess there's a lot more. Yeah. Everybody that seems to contact me and is like, I have an F and it's getting really, really, really expensive, and because of my health issues and whatever, I just can't switch. So I probably, yeah. So there's, I guess, a lot more options out there to switch from F to a G. Gabriel asks, will chapter help you choose a Medicare plan if you're under 65 on SSDI?
1,000%. We do this all the time. There's 13 million people on Medicare who are younger than 65.
But in most states,
was that question about Medigap or Medicare Advantage?
It's about anything.
Okay.
It's about
So
either one of those.
I think I know what you're about. Go ahead.
Yep. And you know exactly what the question I'm going to ask. In most states, pretty much all you can get is a Medicare Advantage plan, right?
Right. Which still provides an out-of-pocket protector compared to what you would owe if you just had straight Medicare. Then you would owe 20% out of pocket for your medical expenses, and sky's the limit on that 20%. So a Medicare Advantage still might serve you well, right, if it covers all of your doctors, covers your prescriptions affordably, and meets your priorities for the upcoming year.
Perfect. Perfect. And then, as I always tell people, once they're approaching 65, then they can go ahead and get a Medicare supplement plan, even if they're on disability, because there's no health underwriting and they can't charge them any extra or anything like that, correct?
Correct. If you're in your Medigap Open Enrollment right, which is the 6 months after you turn 65 for someone who's either starting Medicare by way of turning 65, or you're already on Medicare but younger than 65, that is your golden opportunity to sign up for a Medigap plan without any questions about your health history, and you can't be price discriminated against.
Perfect. Perfect. Gloria asks, what about those that retire after open enrollment? So if you start, okay, I'm seeing if I understand this correctly. So if you currently have a Medicare Advantage plan, or a Medicare supplement, and you want to take advantage of this annual enrollment period, October 15th to December 7th, then awesome. If you have a Medicare supplement plan and you want to see if you can save some money, you can do that 365 days of the year. You might, depending on your state, you might have health underwriting. But if you are new to Medicare, so if you retire, let's say you retire January, February, March, April, or whatever the case may be, and then you sign up for Medicare Part B at that time, then the clock restarts. So where you kind of have a new clock, right?
That's
Anytime you sign up for Part B, then you can sign up for pretty much any plan, right?
Right. The annual enrollment period is for those who are already on Medicare. So Glory, if you're not yet on Medicare, don't worry about it.
Perfect. Okay. And unfortunately, we are at an hour and we're out of time. I think Ari needs to get back to the phones. There's probably 1,000 calls waiting for him there. You got any final things that you want to answer there or address before you go back on the phones and help people out?
I just want to thank all your viewers for their engagement during today's Q&A. And for those of you who have already called to confirm their coverage for the upcoming year, thank you so much for giving us the opportunity to help you.
All right. Thank you, Ari, as usual. And please get some sleep. Take care of yourself. And hopefully we'll have you back. We're going to have Sarah from the member success team in about a week or so. And she's the one that you're going to be contacting, 365 days of the year, potentially, if you have any issues with prior authorizations and billing and finding a new doctor. So we're going to have her within a week or two, and she'll answer any of the questions about follow-up and making sure you get everything that you paid for. Yes, even though the Medicare Advantage plans are zero premium, you still paid for it all those decades you paid into FICA, and you're paying for it when you pay the $185. So it's important that you get everything that you paid for. And she's there and her team is there to help you do that. So thank you again, Ari. I sure appreciate it. Take care of yourself. Say hello to everybody and thank them all for helping my community out. Our community helps other people throughout all this nightmare, survivor benefits, disability benefits. And we really do appreciate you all helping out our community as well. You're too awesome.
Thank you, Dr. Ed.
All right. Y'all take care. Have a great night. And please, 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 please take care of each other.